Hi everyone, my name is Kirsten Dado, and today I'm presenting Disaster Lessons from the COVID-19 Pandemic in Toronto, Ontario. This presentation focuses on three types of lessons. Lessons learned refer to knowledge or understanding gained by experience and changes made to address problems. Lessons observed are those that have been documented but not yet acted on, and the same problems may repeat themselves. Lessons lost are failures that have occurred, perhaps due to lack of resources, which may repeat themselves in the future. To provide some background, Toronto is one of the most multiracial and fastest growing cities in North America. The first confirmed Canadian case was identified at Sunnybrook Hospital on January 25, 2020. The COVID-19 response included mask mandates, lockdowns, and vaccination campaigns. Vulnerable communities, such as racialized residents, low-income neighborhoods, and essential workers were disproportionately impacted. A lesson learned is the city's response to address immunization health inequities. Marginalized communities in the GTA faced higher infection and mortality rates. Access to testing, vaccines, and reliable information was not evenly distributed. To address these problems, the city created vaccination campaigns and provided supports for specific minority groups. Several immunization strategies were also created. For example, the Accessibility Task Force was created to enhance access to COVID-19 vaccines for those with disabilities. The Black Scientist Task Force was created to address Black community concerns such as vaccine hesitancy. In addition, vaccine engagement teams were developed to support vulnerable groups such as isolated seniors, homeless individuals, newcomers, and racialized communities. Moving on to lessons observed, COVID-19 highlighted the challenges faced by the healthcare workforce. Namely, Canada's supply of healthcare workers was unable to keep up with the demand of services, particularly those concerned with hands-on care such as physicians, nurses, and personal support workers. Some contributing factors included limited workers with sufficient education and/or training. Also, workers experienced burnout, which negatively impacted health outcomes and employee retention. To address these problems in the future, it is recommended to expand the scope of practice of health professionals. Training, accreditation, and the success of students in less popular programs should be promoted. Enhancing the status and compensation of providers in short supply, such as family medicine and PSWs, is also recommended. A lesson lost was the negligence of long-term care homes. LTC residents experienced disproportionate deaths, prolonged isolation, and reduced quality of life. Some causes of this failure include the lack of integration across care sectors, which led to poor infection control. Staffing issues such as reduced levels of regulated health professionals and undervaluation of housekeeping staff contributed to poor functioning and service delivery in LTC homes. To address these failures in the future, LTC homes must develop approved plans for responding to infectious outbreaks. In-person inspections must take place to ensure the safety of residents and workers. Workers should be provided with full-time work with equitable pay and benefits. Also, stronger supports should be given to residents to connect with family and friends. The COVID-19 pandemic has shown the importance of adapting during a crisis while continuing to meet the health needs of the population. Hopefully, with these lessons learned, observed, and lost, we may continue to improve policies and practice in public health. Thank you for listening.